So hello guys, thank you for being here with us. Remember hit the like button and subscribe and share with your friends so more people can see those kind of questions. So I would like to just read a couple questions today. Let's do two, at least two. So here we go. Let's see what we have here. So, a 28 years old woman comes to the clinical with a pain. Uh, come to the doctor or the clinician with the pain and numbness in the both hands over the last 6 months. Cold temperatures seem to be precipitate those episodes. Okay, she is not tolerant to cold. So medical history include exercise-induced asthma. So that's her medical history: exercise-induced asthma, lower back pain, and hypothyroidism. The patient takes levothyroxine for her hyperthyroidism. For her hypothyroidism. So patients take levothyroxine daily. She does not use alcohol or illicit drugs, but has a 10 packs years history of smoking. Laboratory studies show normal complete blood count and chemical panels are normal. TSH is in 4.7. TSH is in 4.7. So I'm assuming this is normal. Let me see. We have to check the TSL is in normal or not. TSL, TSH, TSH is between point 0.4 4.0 point 0.4 4.0. Okay, 4 to 4. So sorry guys for the noise here. There's a lot of noise in here. It's my kids watching TV. So point yeah, this is a little bit high, but this is not that much to be aware. Like it's not that much to be worried. So let's go back. She does not use alcohol, illicit drugs, or bodies take 10 packs of smoking history. Laboratory storage showed normal, a complete blood count, and a chemical panel. They're normal. So THH is 4.0. Remember, it is between 0.4 and 4.0. So remember 44. So anti-nuclear antibody screen is negative. So physical examination findings are shown in the images below. So we have somebody with a hand, and the hand is like a red color. Like it's supposed to be a normal color, and then you have an area here of white pill. So no, it's not blood is coming, it's getting there. So not enough blood is getting to the end. So this is obviously a renal phenomenon. So the questions say, in addition to smoking cessation, so stop smoking, which of the following best initiate which, which of the following is the best initial therapy for this patient? So I get it wrong here, as I was increased the levothyroxine dose, but that was a wrong answer. The right answer is amlodipine. The options are amlodipine, clonopin, increased levothyroxine dose, lisinopril, and metoprolol. So the correct answer is amlodipine. So guys, associate renal phenomenon with amlodipine. The treatment is amlodipine, calcium channel blocker. So let's see. So there's two kind of renal phenomenon. Okay, so we have the primary renal phenomenon and we have a secondary renal phenomenon. So a primary renal phenomenon is the cause is unknown. Clinical presentation could be a young lady under the 30 years old, no tissues injury, negative and anti-nuclear antibodies, and those kind of lupus or tests are negative. So in management is avoid aggravations factors like alcohol or tobacco, and calcium channels blocker for persistent symptoms. Okay, so that's the answer. That's what I want you to know. So renal phenomenal here is in young ladies less than 30 years old. This is the one that is primary. Is treated with calcium channel blockers. could be amlodipine in this case, but there's another channel kind of blockers. There's a nifedipine and a amlodipine. So that's what you have to bear in your mind. So primary renal phenomena is an increased vascular response to cold temperature or emotional stress. It is usually found in young ladies less than 30 years old. Symptoms of systemic symptoms of systemical episodic attack. So there's like a systemic episodic attack and symmetrical. Symmetrical mean like it have to be in both hands at the same time, or both legs or something like that. But then you have to be. They say it is symmetrical, like the same both sizes at the same time. So it's found in young women less than 30 years old. Symptoms of symmetrical episodic attack with evidence of peripheral vascular disease. I mean, there's no evidence of peripheral vascular disease. I mean, everything is normal for just suddenly that lady start feeling that white patch on your fingers, on your toes, or things like that. So there's no tissue injury, okay? Because that's the other one, that's the secondary one. So, or a normal ninefold capillary examination on examination. So everything looked to be normal as long as you have those white patches with history of alcohol or tobacco use in young ladies. Okay, that's a that's a primary phenomenon, primary renal phenomenon, and it's treated with amlodipine. Okay, that's that's what you want you to know. You can read this. You can pause and read this right now, and you can pause and read the other questions. Thank you very much, guys. Bye. Just hit the like